Hi, our group's presentation is on circumcision and cord care. Circumcision is a surgery to remove the skin that covers the tip of the penis, also called the foreskin. The procedure is fairly common for newborn boys in parts of the world, including the United States.
I'm Mrs. Daisy, so they let me know that you wanted to circumcise Billy here. So I brought the consent form, but before we have you sign that, we're going to go over the procedure and some risks. So the procedure is a sterile one. It lasts about 15 minutes, and we're going to go in and remove the foreskin of the penis, so the top portion that surrounds the head of the penis. And during the procedure, we're going to be giving the baby some sugar water so they can relax a little bit, and we're going to be giving a small injection of lidocaine to numb the area. So lidocaine's a medication that numbs. That way they won't be under any pain during the procedure, and post-procedure we'll be giving them Tylenol to also help with that pain. So for associated risks, there is mild bleeding. We do put a special gauze around the head of the penis, so that should fall off in a couple of days, 1 to 2 days, but there shouldn't be any heavy bleeding. We'll monitor that, as well as any signs of infection. Since this is a sterile procedure, the chance of infection is very low, but we do want to keep an eye on it as well. And as I mentioned before, we are going to be using the lidocaine medication to numb the baby. So there might be signs of a rash afterwards, mild reaction. It shouldn't be anything too heavy as well, and we will also be monitoring that. So, do you have any questions? No? Okay. So we'll get you to sign this form here, and then Nurse Carla will be in to go over what you're going to monitor at home when you take home the baby.
So hi, my name is Carla. I'll be your nurse today. I'm in here to give you some instructions on how to care for the circumcision. So you want to go ahead and clean your baby's bottom as you normally would. So you're going to want to squeeze some water on top of the penis. You pat dry, and then you want to use Vaseline and a gauze bandage. You want to use Vaseline, and you want to apply it here with the gauze. This should be done with every diaper change for the first day of life and the second. So a small amount of bleeding is going to be normal. If you see more than a quartered size spot of blood on the diaper, then you want to make sure to call the baby's doctor, because that is not normal, and you want to make sure to stop the bleeding. So you want to hold a cloth or a gauze over the penis.
Call your doctor if the baby has a temperature over 100.4 Fahrenheit, if the baby hasn't urinated in 24 hours, if the yellow ooze coming from the baby has a bad odor, if the redness is starting to crawl up towards the belly button, or if there's a bleeding size, the size of a quarter on the diaper.
For cord care after surgery, rinse the area with water. Avoid using commercial diaper wipes. And if you are bathing, if your baby still has his umbilical cord attached, give him sponge baths after surgery. Gently clean the penis with soap and water 2 to 4 times every day until the ring comes off and the penis is healed. Take it away, guys.
My name is Kathleen. I'm your nurse today. Today I'll be talking to you about some information about umbilical cord care. Since you're going to be going home soon, it's important that you're given some information just to help prevent infection with your baby's umbilical cord, especially since it's quite a entry point for infection. So I'm just going to teach you some important things just to make sure that it's taken care of. Okay, so when we begin to take care of the baby's umbilical cord, it's important that you make a primary assessment. So when I say assessment, I mean checking if there's any bleeding, redness, swelling, and any drainage that may convey infection. Always make sure that it's clean, dry, and intact, and make sure that the umbilical cord is also open to air or loosely covered. And if you see that it is soiled, just simply cleanse with plain water and allow to air dry completely. And then for diapers, you should always make sure that it's folded downwards and not covering the umbilical cord stump. Always keep it below the umbilical cord stump. And also for the umbilical cord separation, on average it takes 10 to 14 days, but it can also take up to 3 weeks.
So that wraps up circumcision and cord care. Thank you for listening.